Mood disorders are psychiatric conditions characterized by abnormalities in affective, emotional condition, but also accompanied by abnormalities in energy, sleep, motivation level, and a variety of other symptoms. The two major kinds of mood disorders are major depressive disorder and bipolar disorder. And they're both characterized by having depressive episodes, but bipolar disorder is also characterized by manic episodes. And mania and depression we can think of roughly as being the opposites of one another. In depressive conditions, people tend to have low energy, the mind goes blank, there's a sad mood, there's sometimes thoughts of suicide and feelings of helplessness and worthlessness and so on. Whereas in manic episodes, people have excessive energy, reduced need for sleep, more impulsive, risk-taking behavior, more goal-directed behavior, sometimes grandiosity, and even frank psychotic symptoms. Um, and both conditions are common. Major depression is more common than bipolar disorder, but bipolar disorder, depending on how you count and what kind of conditions you include in that definition, upwards of 1% of all people actually will be diagnosed with a bipolar disorder. Um, there are other clinical challenges in the lives of people with bipolar disorder. The big challenge is stability over time. For reasons that we don't fully understand, bipolar disorder is associated with dynamic change. Even after extended periods of doing well and functioning at a very high level, people with bipolar disorder can have a relapse and start a new cycle of episodes and then trying to get back to wellness. And during those cycles, there are some common clinical challenges. Among them are substance use, which includes alcohol use disorders, but also other substance use disorders. There's psychotic features. So people with bipolar disorder can actually become, frankly, psychotic, start to experience hallucinations or delusional thinking. Those are hallucinations are having sensory experiences like hearing things when there's no stimulus there. And delusional thinking is thinking that has no basis in reality, but the person is firmly entrenched in their beliefs. And finally, suicidal thinking and suicidal behaviors. These are also unusually common among people with bipolar disorder. So bipolar disorder can be fatal if it's not taken seriously and treated in time.